Okay, we are back with the last interview of the day here at the Congress Growing Smile in Turin, and we are with Dr. Martin Pedernera. Hello, Martin.
Hello.
Thank
Nice
you.
to be here.
Thank you for joining us. It has been a long day, and we really appreciate that you are here with us. And I want to ask you something about your talk of this afternoon. The management of impacted canines with aligners. Okay. Which are the main advantage of using aligners?
I believe that the main advantage of using aligners combined or in cases of impacted canines are the main advantages that you can find for every single case.
Okay.
Just the fact of using aligners gives you the same outcome, sometimes better outcome than with fixed appliances, and related to the comfort of the patient, the hygiene of the patient, there is no comparison. So I believe that treating impacted canines with aligners is absolutely possible. I show that, and with not an extra effort, and combining the advantages to that complex treatment, which are better hygiene and more comfort for the patient.
Yeah, and the compliance as well is very easy.
And the compliance, the compliance of the aligners, it's something that could be, good or bad in this sense. You compared to the patient with fixed appliances, braces, it's like one more thing that is hurting and so on. So it could be something that leads to the patient to cooperate a little bit more. The fact that, okay, I'm not wearing braces, I'm wearing aligners for my treatment. I'll do my best. I'll behave. I'll be a good boy, good girl.
Yeah, this is important. And you said about the help of the tools and support of the treatment plan.
Yeah, there's plenty nowadays that we live in a digital world. Nowadays we are sometimes digitized and into the treatment plans. Let's call it clean check. We don't only have the possibility of moving teeth and arranging a bunch of dental movements, but on top of that, there's plenty of digital tools, as the ruler, as the combination with the CVCT, that makes our treatment plan much more informed, to be more secure, not only for us, especially for the patient. So it's like technology is there. It's available for all of us. Just use it in order to create more, let's say, precise, reliable treatment plans.
What do you think about the use of artificial intelligence in planning?
Nowadays, it's changing the whole game. I mean, we changed the workflow that we used to do, not far away from here. Probably, if I go back in time 3 years, we used to organize our treatments in some way. Nowadays, thanks to the artificial intelligence, we get a lot of automatized processes that help us to upload a case, get a treatment plan, just modify it, work on the staging, and probably in the same day that you upload the case, you get the opportunity to approve. So it's helping us mainly saving time.
Yes, you don't have to set up everything, just fine-tuning.
Automatizing things and saves a lot of time, which I believe that was one of the weak parts of planning, modifying, expecting for the modification to come back, then working again. It's too time consuming. It's not like that anymore.
Okay, a question about TADs in treatment of impacted canines.
Yes.
How they improve the effectiveness of the treatment in your experience?
I was mentioning in the lecture that the fact of not only considering using TADs, but to have them as your backup, as your resources that you can use. It's not mandatory, but I consider the fact of having that it's not even a technique, but the skeletal anchorage that the mini screw provides us help us to invent, to get new vectors of forces and related to impacted canines. One day you have the canine more mesially, less inclined, more distally, more palatal, more labial, and with the tats changing the position, you get to adjust and fine-tune the vector of the forces. So I consider them like mandatory, at least to, I have them on my side. And if I need to use them, I just go for it. Yeah.
Okay. From what age you consider to use tats?
I don't normally use tats in when I'm in growing patients or early ages, but since 14, 15, which are the cases that you probably, if you get them on time, and I need to work on an impacted canine in a patient of 14, 15 years old, of course, it's still growing, but I will consider them. I would try to avoid them.
Okay.
That's the thing.
Okay.
I try to avoid any single auxiliary that is not extremely necessary to do. But if I have to, the use of the TAT during a 15-year-old treatment will reduce the amount of time, reduce the cooperation, increase the predictability and the effectiveness, I'll go for it.
Okay. Martin, last question. Before you go, an overview, your point of view about the main topic of this Congress.
The growing smiles, right? The growing smiles.
Yes.
I believe, and it wasn't only me mentioning the importance of getting to get to the patient, to get that first appointment as early as we can. 6, 7 years old, Sandra Tai was telling, in the American Association of Orthodontists, is recommended at 7 a.m. at 7 years old, at least, to have that first appointment and to be able to treat them as soon as possible, because and we've seen that many in all of the presentations, that the benefit of working as soon as possible is much bigger than the price that you have to pay when you have to correct in an adult.
Yes.
So directing the attention to the growing patients in this Congress, I believe is like spot on.
It can be useful and important to change the mindset, the approach to kids.
For sure. I mean, it's to give them the importance to the early ages and the early treatments. And we shouldn't forget about how to treat adults, but if you can prevent that, so we have to push harder, and in all the orthodontic community should work harder on getting to detect problems as soon as possible and redirect the growth and direct the efforts in preventing bigger issues.
Okay. Martin, thank you very much to join us.
Thank you very much for the invitation. Thank you.
Thank you.